Now, mortuaries for preserving dead bodies in various health facilities in the eastern region are reportedly getting full following a strike by environmental health officers. The nationwide strike action by the environmental health officers Ghana started sometime last month over what they describe as poor working conditions. According to the group, the environmental health practitioners burying the bodies lack the needed resources to carry on with their job. That until the key actors in the health sector, they are the Ministry of Health and Ghana Health Service, supply them with the needed PPEs, the association will continue with the strike. This strike, which has dragged for close to a month, has got some families frustrated as bodies of their relatives who died from COVID have been abandoned at the morgue. National President of the Environmental Health Officers for Denchambo Yao Akwa Latte joins us now via Zoom for more. Mr. Latte, I'm grateful for your time. How serious is this situation?
Yes. Can you hear me now?
Yes, loud and clear.
All right. A very good afternoon to all your viewers and environmental health officers across the country. Yes, it's true. Bodies are being put up at the morgue across the country simply because we lack the necessary logistics to be able to give a safe disposal of the dead of COVID-19 in the country.
And what has been the response of the Ministry of Health and Ghana Health Service to this situation?
Yes, I think we laid down our tools on Wednesday, 18th August last month, and so now no government official or anybody who matter as the stakeholders of this country has engaged us. So we are still there. We are waiting for their response because without the necessary logistics as stated in the Labour Act 2003, Act 651, Section 118, we cannot go with our bare hands to tackle COVID-19 dead bodies in the morgues for a safe disposal, the Public Health Act, Section 50, 1 and 2.
Mr. Latte, I want you to paint a picture of the situation right now for us so we can understand what you are battling with.
Yes, what we are saying is so simple. Now we need three things. Since the inception of the COVID-19 in this country, when Honorable Health Minister Kwekwa Jimamenu made a first statement, a written statement of COVID in the country, we environmental health officers also mobilize our forces. Along the line, government procures personal protective equipment and distributed it across the Ministry of Health Ghana Health Service staff. Notwithstanding, we are also health workers who have been transferred in 1994 to the local government service.
Okay, so you are Akwa Latte, who is the National President of Environmental Health Officers Alliance, Ghana. Okay, go on.
We have been working with our own personal protective equipment since the day one of COVID being recorded in the country. Along the line, we are the front line and back line health workers. For the back line, our duties are to give a safe disposal of all death in this country, whether animal or human beings. And COVID-19 dead bodies fall within our mandate. So we have been burying without the necessary logistics, such as cover-up, gloves, nose mask, the N95, the goggles, the apron, the scraps, the chemicals that will be used. We are saying that the Ministry of Health, who is in charge of all health situations, all pandemics in this country, should be able to give us all these logistics and necessary PPEs to be able to don and give a safe burial of all the dead bodies across the country. Currently, as we speak, we are not getting it. When we receive the dead bodies from the Ghana Health Service, that's the hospital, the nurses, the doctors, or the mortuary attendants, we have to go to the district director of health services. And what they get, what they have is what they give us. So we go to them, and what we normally get are the coverall, the one which has a cross, blue cross at the back. They don't have quarantine boots. They don't have goggles. And the coverall, the one with the blue cross at the back, what happened is that after every burial, we disinfect ourselves and discard it. It is bent. So as and when we bury, we discard all those things. And we don't have it. Getting it at the stores, outside the market, you will not get it. You come through town, you will not get it. So we are saying that we are health workers working under the local government service. For that matter, the metropolitan, municipal, and district assemblies. So the Minister of Health, during the distribution of these PPEs, should be able to use the decentralization that we have in operating in this country and distribute these PPEs to the regional coordinating councils, to the metropolitan, municipal, and district assemblies.
What kind of engagement what kind of engagement have you had at the local level?
Yes, at the local level, when we receive bodies from the hospitals, at the regional levels, they have communicated to us, the 16 regions, that those are the teaching hospitals who take delivery of these bodies. We like the Cape Coast Hospital, the Kolebus, the 37, and those at the regional level take delivery of these PPEs from the teaching hospital or the regional health directorate. But we who are working at the municipal and district assemblies don't take the PPEs from the regional level, but we go to the medical district director of health services, and they tell us that their PPEs were given to them to be given to their staff, not we, the staff at the local government service. So that has been our challenge. So now that we are not getting, now the new variant is so deadly. And last year, officers who were engaged in these burials had infected with some of this COVID, the second wave. And the insurance package the government promised, they did not get. The tax waiver that were also given, promised by government, from April to December 2020, we were neglected and sidelined. Association took it upon ourselves to write a petition upon petitions through the office of the head of local government service. He also accepted, received the letter, put a cover letter on it, and forwarded it to the Minister of Local Government. The Minister of Local Government also received, acted on it, and forwarded it to the Minister of Health. We presented this letter on the 7th July 2020. It took time, July up to May this year, 2021. That's when the first tax waiver was paid. And it has been paid in installments, monthly installments, first batch, second batch, third batch. As I speak now, over 500 environmental health officers. So this has been a challenge for us as professionals who are mandated by the Public Health Act 2012 Act 851, Section 50C, to dispose all dead bodies, whether animals or human beings, in a safe manner.
So what do you want from government right now?
What we want government and all those who matter in this country is, one, we need the logistics, especially the personal protective equipment as stated in the Labor Act 2003, Act 851, Section 118, which states, paraphrasing, that before the employer employs you, he must give you the necessary personal protective equipment. And it is stated in 118, subsection 2E, says, I quote, supply and maintain at no cost to the worker adequate safety appliances, suitable firefighting equipment, personal protective equipment, and instruct the workers in the use of the appliances and equipment. We have not been given these equipments. How do we don and take this bull by its horn to bury COVID-19, this deadly COVID-19 dead bodies? And one thing that we should know, that
all right, so Yakwa Latte, he is the national president of the Environmental Health Officers Alliance Ghana, and he's been making that point that they need personal protective gears to help them bury dead bodies from COVID-19.